Today, I examined a 27-year-old patient whose main complaint was positional vertigo. As usual, I started with a Dix-Hallpike maneuver on the right side. I'm currently performing the maneuver on the right, but in this position nothing happens. The patient doesn't experience any nystagmus or vertigo. After returning to a sitting position, everything remains normal. Next, I try to perform the Dix-Hallpike maneuver on the left side. But again, no complaints or vertigo occurred. I'm preparing to perform the roll test, and now I'm performing the roll test to the right side. In this position, we observe rotational nystagmus toward the right, accompanied by a strong sensation of vertigo. The nystagmus lasts several seconds and then gradually subsides. Next, I'm performing the roll test to the left side. But in this position, no nystagmus is observed, and the patient doesn't report any vertigo. The patient is now returning to a seated position. So the diagnosis is right posterior canal BPPV. In these circumstances, I choose to perform the Semont maneuver to treat the patient. After performing the Semont maneuver, I re-evaluated the results, and now I'm repeating the Dix-Hallpike maneuver on the right side. In the right Dix-Hallpike maneuver, nothing occurred, so I proceeded with the roll test on the right side. Here, I perform the roll test to the right, and I still observe rotational nystagmus to the right, along with the patient's vertigo. Since the rotational nystagmus on the right persisted during the roll test, indicating right posterior canal BPPV, I decided to proceed with the Epley maneuver. After completing the Epley maneuver, I re-evaluated the results by performing the Dix-Hallpike test on the right side. In the Dix-Hallpike position on the right, nothing occurred, so I moved on to perform the roll test on the right side. During the roll test on the right, I again observed rotational nystagmus to the right, which is typical of right posterior canal BPPV. Despite this, the diagnosis still held based on the roll test findings. Now I'm performing the half Dix-Hallpike test on the right side to check for any issues with the posterior canal. However, no abnormal findings were present. Now I'm moving on to the Bascule Maneuver. Since both the Semont and Epley maneuvers performed so far were ineffective for this patient. The Bascule Maneuver is typically performed in plane of the left anterior and right posterior canals. I pivot the patient from the right side to the left and back multiple times, specifically along the LARP plane. And at each final position, the patient stays for at least 20 to 30 seconds. What was atypical in this case was that 3 times the right posterior canal BPPV was identified during the roll test, rather than the Dix-Hallpike maneuver. This is very unusual as the posterior canal typically appears in the Dix-Hallpike position. Thus, the key takeaway is that it's not the maneuver we perform that dictates the diagnosis, but rather the nystagmus pattern we observe regardless of which test we use. After completing the Bascule maneuver, I performed the roll test on the right side. In the follow-up roll test on the right, there was no nystagmus and no vertigo, so the patient is now symptom-free.